Hi, Sami. How are you?
Hello. Oh,
Eccola qui
hello.
la Cristina.
Buongiorno, Enrica. Buongiorno,
Buongiorno
Carmelo.
Cristina.
Hi,
Buongiorno,
Sami.
mi senti?
Sì, sento tutti.
Aspetta, io non sento.
Am I upside down? Am
Yeah,
I?
you're a little
Yeah.
bit upset that you have
Okay,
to...
okay. I don't know.
Ok, è sparita.
È perché
Speak.
forse ha messo a posto
Done speaking.
qualcosa.
Ok, mi senti adesso, Cristina?
Io ti sento, Carmelo.
Anch'io.
Buongiorno,
Buongiorno.
buongiorno.
Sei bellissima con questo colore. Stai
Grazie,
benissimo.
grazie. Buongiorno a voi. Hi, Sami.
Hi, doctor. Hi, everybody. How are you?
Hello.
Dai Sami.
Hello. Hi.
Enrica
How are
and
you?
Carmelo are the translators. They are professional translators and are helping me always with my live sessions with people outside from Italy.
Oh,
And
wow. Italy. I'm so excited.
yeah,
I'm gonna be in Italy.
and you live in Tokyo,
Yeah, actually, Yokohama next to Tokyo.
Yokohama. Okay.
Yep.
Okay. I've
Right.
never been there. Okay.
Oh, what a pity.
Yeah,
I'm gonna
that's
get you from here.
we hope that there is enough time to
Mhm.
take this journey. Okay, Sami,
Yes, indeed.
I'm very grateful that
Mhm.
you agreed for this session. It is very dangerous for me to make this session with you because I have big problems with establishment here in Italy because of my declarations about carnivore diet or low carb diet or keto diet.
I should have guessed it, doctor. Actually, even my YouTube video, some of the YouTube video where I was talking about cancer, metabolic approach were taken down. Censorship.
Okay, I think we are going, wait, I'm very conscious that I'm going to have this possibility also, but I don't care. I think we don't say, I think it's very important to tell your story because you had surgery, you had chemotherapy, you had
Yes, I did.
the full story. But what I can't tolerate anymore, these declarations that meat, that red meat is carcinogenic because we don't know.
Oh, possibly carcinogenic? So annoying. Full of
No,
bullshit. I'm
yeah,
sorry.
it's very annoying
Yes.
because, but there is a big fight against meat.
Yes, indeed.
Yeah, and you know it. I'm very curious to see if they're going to take this YouTube because I'm going to spread this live with you in my YouTube channel. I'm very curious to see what happens. I don't think I'm gonna to get more problems than I actually have now.
Yes, doctor, this is the thing. Actually, to my ignorance, I can't speak Italy. I don't understand Italy. That's why I know what kind of thing you are talking about in your videos. That's why I sometimes think that, oh, how could the Christina is able to provide this message where there is a big movement trying to, push the carnivore or let's say meat-centric diet away from the, let's say general approach. Always end up, we've been told that, hey, green, plant-based, vegan. Oh, that's why sometimes I wonder, how could you possible to let get that message across to your audience without being, shadow banned or censorship?
You don't have to worry about it. What's important, we are now telling your story, and then it's a true story.
Yes, my experience.
I mean, I had also chemotherapy. I know what it means to have chemotherapy. We are not selling the message that they don't have to do it, but we are telling your story. And I think it's an information more for my community. And what's important, you have a past from veganism, and I'm fighting the conventional veganism, while vegan people, most of them are eating only or mostly processed foods.
Yeah. Oreo and cookies and drinking shake, it can be vegan, right?
No, I mean, I haven't met until now a conscious vegan
Oh, I'm sorry. Yeah.
who calculate the amount of proteins and the amount of micronutrients. So maybe that when you were vegan, you had also problems. Did you have a life with Professor Seyfried?
Oh yes, I did. I was lucky enough to have an opportunity to talk to Dr. Seyfried at a meeting in Boston College. Zoom meeting, by the way. Yeah, I did have a conversation with him.
Okay,
great.
We could speak that you had a meeting with him. It's important about the metabolical
approach to cancer,
approach.
right?
Yes, but he's one of the biggest one worldwide, but his message hasn't arrived
no
in Italy.
Yeah, right. Yeah. Oh, I see. Oh, I see.
And do you have problem in Japan because you are carnivore?
To be honest with you, doctor, I don't have a Japanese friends. Not for some reason. I have international friends here. They know what I'm eating. They know how could got away with not dying from cancer. That's why I have no problem in social occasions. They know, but I have big problem with my medical team, my oncologist and doctors. Actually, they gave up on me already. And I haven't gone to the hospital more than 5 or 6. When was the last time I went to the hospital? It would have been March. Since then, I didn't check up anything. But I think I'm going to talk about in your show that the thing is that I went off the keto approach. I forgot about I was cancer patient to the point that I was not following Dr. Safety approach. And I developed new metastasis just 1 year ago. New cancer cell developed.
But when have you been, Sami, excuse me, when have you been operated from your colon cancer?
2 years ago. 2 years ago.
21.
2.5 already. Yeah, 2022, actually. 2022? Yes, 2022. No, 2021. Thank you. 2021. In May. And then 1 year ago, exactly 1 year ago, October, they found a new metastasis in my lung because I was off keto. Then I forgot to take that approach. I didn't take glutamine blockers. This is one of the substrates cancer can utilize to get the ATP. And also, I was in a deep ketosis, during which I developed new metastases.
Wait a moment, I don't understand what you mean. You have been diagnosed with lung metastasis 1 year ago?
Oh, no, actually, the first diagnosis 2.5 years ago, this 2.5 years ago, which was colon cancer stage 4 terminal metastasized to liver. That's why I had an operation. Half of the colon was out. 1/3 of the liver was out. 4 lymph nodes were out. Appendix was out. And then the 3 months later, even on my chemo, they formed new metastases in my liver, but I didn't take operation because I hated the way they think about my approach. They didn't listen.
But
They didn't listen.
when did you begin to eat carnivore?
Oh, it was 2018, 7 years ago.
Why?
The reason was because previously I was severely suffering from eating disorder, 24 years. And this is the time I developed my colorectal cancer by taking 250 laxatives a day. To cut the long story short.
Laxatives.
And laxatives, as a compensation of binge eating. This is the time I developed colorectal cancer. And then to help my psychiatric disease, I tried ketogenic diet, which was in 2011, way long time ago. Keto was a thing. I tried a ketogenic diet. That helped my eating disorder improvement.
Yes.
But, my digestive issue, especially bloating, didn't help by ketogenic diet. And then 2018, I formed the diet called zero carb diet. It was going to be called ketogenic diet later on. I was one of those first people who tried ketogenic diet, carnivore diet, nearly 8 years ago.
But where did you find it?
I don't know. It wasn't the Google stuff. Maybe, kind of a search engine thing, I don't remember actually. I came across a zero carb diet, zero carb.
And why did you decide to get on carnivore?
Because, my psychiatric, condition improved, but my bloating was so awful. Where
What was awful?
Bloating, distended gut.
Gonfiore, il meteorismo.
Grazie. Okay.
Yeah, right. So then the carnivore, day one already, I was able to reverse my distended, the big gut, flattened instantly by being on the carnivore, miraculous. And also my energy level went through the roof easily. Then I started to do weightlifting because of my, energy coming from meat. Finally, I had been on vegetarian almost 2 decades. I was absolutely malnourished. Then I getting a meat. Of course, my body, oh, holy cow, this is a true nutrition. And then I became healthy and strong. Since then, I've been on a carnivore diet.
And which meat do you eat mostly?
That's a good question, doctor. At first, I dove into only beef, salt and water diet, lion diet at first. And meanwhile, I was diagnosed, operations, chemo. After that, I thought that I want to be big, strong, jack, like a gym rat. And then I switched to not only beef. I ate a lot of pork, chicken, fish, monogastric animals, which was mistake. Why? Because when I eat ruminant animal, let's say beef, my ketones is gonna high. But when I eat monogastric animals, pork, chicken, fish, eggs, my ketone level goes down. Why? Okay. Because, I think I might have an immunological response to monogastric animals. One of them or two of them, all of them. That's why, during the time I'm off the keto, trying to be big, increasing a protein, that time I developed new cancer cells, metastasis in my lung. 1 year ago. That was a mistake.
Sorry, can I ask
Yes.
a question?
Yes.
When you say, nice to meet you, first of all.
Nice to meet you. Yes.
When you say you are off keto, it means you are on, actually.
Sorry, there was an interruption. Could you tell it again? Sorry.
No, because you were saying when I'm off keto, it means when you're on keto or not.
During the time I was eating a variety of meat, fish and pork and chickens and stuff, I should have been off the ketosis, off, because of the high protein.
Off ketosis and not off keto. Okay, it's clear. Okay.
Yeah, thank you. Thank you very much.
E infatti hai chiesto la domanda tu che volevo fare io, Enrica, perché ha detto anche aspetta che non riuscivo a capire. Okay, you were off ketosis because of that, but not because of the amount of proteins you've eaten, but because of the kind of protein you've eaten.
Both, doctor, both. The excessive protein that's gonna convert it into sugar through the process, gluconeogenesis in my liver.
Yes, but if you eat the same amount of beef and the same amount of pork or chicken or fish, have you seen there a difference in your ketosis?
Yes. At that time, I didn't care. Even I didn't check the ketone glucose number. Why did I notice was the fact that later on, after my Instagram, the channel went popular, one of my followers, she's a cancer biologist, she kept telling me, hey, Sami, check GKI number, glucose keto index. Then I checked upon my GKI number. It was alarmingly high, where I was eating, chicken, pork, and fish and stuff. And then I tried to, increase the fat, taking a taro, the butter, and try to boost the ketones, but it didn't work until I stopped eating monogastric animals and switched to the beef diet. Then my ketones went way, way high. Then realized that, that was the reason I was off on ketosis.
Yeah, but then we can't say that you get off keto because you have.
Yes, just my assumption actually.
No, you mean because it doesn't happen when you eat beef, but it happens when you eat monogastric animals.
Yeah.
I mean, indifferently, if you have the same amount of meat eaten, and have you find other carnivore people that who have the same problem as you had with monogastric animals?
I don't think so, but I am kind of confidently tell you this. My hypothesis is because some people who have autoimmune diseases or leaky guts, when you eat ruminant animal meat, aka beef, ram or bison and stuff, most likely they are able to improve their situation. The reason is because, doctor, ruminant animals have four stomach chambers. They digest the food thoroughly using four stomach, very complicated process, using the like a special bacteria, enough to the point that they can detoxify the food they are eating. That's why their flesh is less inflammatory despite of their food. They were given sometimes corn and soy and stuff. Still, I would say their flesh is relatively safe. On the contrary, the monogastric animals, they are just one stomach. That's why what they eat, it's gonna let's say impact on the flesh. What they eat, it's gonna reflect on their flesh. That's why I might have a reaction from the food they were eating.
But if you would eat monogastric animals which have been raised properly with proper
definitely okay. Definitely, I would say
yeah,
okay.
it's very interesting. It's very interesting your point of view, because my community is asking me very often what happens. I mean, we don't get in Italy, or very difficultly properly raised chickens.
Oh, neither Japan. We don't have such a pastoralist. No, but that's why, doctor. Yeah, these days I've been doing consultancy to people who have cancer. I'm working with people with cancer. I don't tell them, hey, go, like the carnivore, strict keto. I wouldn't say, majority of people, they are okay with gastric animal or whatever it is. They were okay if they properly is able to get rid of the plant matters, which is, I think, a foundation of any ailment treatment, disease treatment.
But for you, is it important to be on keto?
For cancer treatment, yes. And in some conditions, like a cancer or severe psychiatric disease or autoimmune disease or type 2 diabetes, you have to be in ketosis, therapeutic level of ketosis, not nutritious level, therapeutic level, 0.5 to 2.5. You have to be in this.
You are from 0.5 till 2.5.
Yeah. This is a therapeutic.
Are you measuring it through your blood with keto mojo, or are you
yes
keto
mojo?
And you are sometimes 0.7, sometimes 1.5. Okay.
All over.
And have you observed that it's better to measure it with keto mojo than with urine stripe?
Oh, urine strip is kind of not so accurate. The reason is because when you start ketogenic diet, at first your body produces a lot of ketone, but that's why your urine has a lot of ketones. But over time, your body okay, I don't need to produce a lot of ketone. Your body is more efficient to use keto to the point that your ketone level goes down. So the urine is just something unused ketone, which is going to be reduced over time. You're more efficient with ketones. So that's why urine is not so accurate.
Okay, no, I agree with you, but it's a very important message to tell also my community. I use also keto mojo, but keto mojo is not so. It's a little bit expensive.
Yeah, the straps are expensive.
No,
I can buy it.
Yeah, but you buy it one time, but it costs in when I bought it so a couple of months ago, it costed about 175 euros.
Really?
Yeah.
Oh man, it was 3 years ago. It wasn't such an expensive purchase for me.
It's really I bought also many stripes. Yeah,
stripes is expensive.
Yeah.
Oh wow!
And so yeah,
but better than nothing. At least you will know that I'm producing a ketones by using urine.
Yeah.
Definitely that's gonna be better than just a guessing. Guessing is never gonna work. Even I don't know. I'm in very high ketone or low level ketone. I can't tell the difference.
Yeah. Okay. Bene. Excuse me, Sami, because we have about 1 minute and a half before we go live.
Yeah.
I speak only with Enrica and Carmelo. siamo a posto con tutto. Io adesso vi chiedo a Carmelo, prima di fare disastri, io ho quindi, cosa devo dire dell'interpretariato, Carmelo? Che loro devono andare sull'interpretariato e mettere
Sì,
italiano?
selezionare dal globo che vedono in
Sì,
basso,
sì,
selezionare la lingua in cui vogliono ascoltare.
sì.
Io direi selezionare italiano.
Ma
E
io,
se
sì,
c'è gente che è collegata col cellulare, andare sui tre puntini o altro.
io non so se sul cellulare riescono a entrare in Zoom.
Però l'altra volta c'era tanta gente collegata col cellulare,
Ma
perché
sono
sai, magari...
riusciti?
Sì,
Ah,
sì, sì. E poi quando lo scrivevano io dicevo andate sui tre puntini, ci sono tre puntini in alto,
perfetto.
selezionano la lingua da lì
Sì.
e funziona. Basta
Allora,
dire
io,
questo.
siccome sono entrata adesso nel globo e mi dà avvia, lo avvio
Sì,
anch'io?
sì. Aspetta un attimo, perché nel momento in cui
Aspetta.
la avvii non riusciamo a comunicare tutti e tre perché parte l'interpretazione.
Ho capito.
Enrica ti voleva dire anche la
Sì,
gestione delle domande,
sì, sì.
come
Come
fare?
le vuoi fare, Cristina? Perché probabilmente ce ne saranno tante, magari anche in italiano, così. Le vuoi leggere in italiano e proviamo con lei che senta in inglese, oppure preferisci fare tutto tu, anche tradurle?
Ditemi cosa va meglio.
Ma forse andrebbe meglio tradurgliele. Lei sembra molto sveglia con la
Sì,
tecnologia
sì, no,
e...
no. Allora tradurgliele che le faccio in inglese subito io.
No,
No,
in
io le leggo in
italiano
italiano.
e noi e lei sente dal globo anche lei la traduzione.
Dobbiamo dirle
Aspetta,
qualcosa?
proviamo. Sami,
Yeah,
can you hear me? Have you ever tried being translated or receiving the translation on
no,
Zoom?
this is first time for me.
Ah, ok. Ma
Oh, possiamo provare, Enrico.
we can try. È un po' tardino, sono già le 9.
Dove
Dai,
le,
proviamo,
le- ok,
falle tu, leggile tu in inglese,
le
basta.
leggo, va bene, ok, ok. Io
Perché adesso dobbiamo ancora...
le leggo magari in italiano prima, che così sentono. Allora, io non ho dato la possibilità alla mia fellowship di fare domande. Io normalmente metto dei box domande, no? Io non l'ho data perché è la prima volta che io faccio una live la mattina alle 9, io di norma le faccio sempre la sera, però ho detto, vabbè, io adesso non gliela do, anche perché ho pensato, io racconto la sua storia, che già avete sentito che a lei gli hanno cavato le sue trasmissioni,
Mhm.
cioè questa io sono perfettamente conscia che questo può essere soggetto a censorship. Questi stanno diventando sempre più imbarazzanti in quello che stanno facendo, no? Però io ritengo che sia una storia da ascoltare e lei è una dei tanti che io voglio contattare in giro per il mondo. Ce n'è uno solo, vi dico questo, che è un professore francese con un, penso, carcinoma anche del colon, che lui però ha avuto un oncologo illuminato e questo con la carnivore si è salvato, ma ci sono delle storie che hanno del pazzesco e secondo me queste storie vanno semplicemente raccontate. Noi non è che stiamo dicendo non dovete fare la chimioterapia, cioè io sono la prima che l'ha fatta, però è giusto che la gente ragioni con la propria
Mm.
testa. Io spero che rimanga, e se no a me la toglieranno e
Mm.
io vedrò di metterla nei miei social, la
Mm.
toglieranno.
Mm.
Che no, anche
Mm.
questo è un test, ci ho pensato bene prima di farlo, no? Però vabbè, ok, allora io
Comunque possiamo dirglielo a lei che può andare lì, possiamo provare
sì, certo,
eventualmente. Cosa dici? Un
sì,
minuto.
sì,
So now, Sami, Christina is
Yes.
going to assign us, to appoint us as interpreters, okay?
Mhm. Yes.
Then you will see a globe in you are from a computer, right? You will see
Group. Yeah,
a
I'm on the
globe
iPhone.
or you are on iPhone.
Yeah.
No, allora lasciamo stare,
no,
va.
Ok,
ok, no,
No, no, no,
right,
no, it's
right.
okay. Forget about it.
We are
We,
gonna to start now, ok?
okay.
Yes.
Allora io metto avvia a voi e inizio il webinar. Ok, perfetto. Quindi voi mi sentite? Magnifico, ci siamo. Cominciamo. Magnifico. Benissimo. Buona giornata, buona domenica a voi. Vi do il benvenuto a questa live e mi fa veramente molto molto piacere poter condividere con voi l'esperienza di Sami, but it's better that I speak now in English because you have the translation. Vi ricordo che voi avete se siete da computer, avete l'interpretariato, che c'è quel globo dove potete attivare la traduzione simultanea in italiano. Se siete col cellulare avete 3 pallini sopra dove potete attivare la vostra traduzione in italiano. Io ringrazio per la loro disponibilità e la loro squisitezza, oltre che professionalità, Enrica e Carmelo, che sono qui a tradurre per voi. Ok, now I'm speaking from now on always in English, so that you can you hear this live with Sami, translated from Enrica and Carmelo. Sami lives in Japan. She lives near Tokyo, but I welcome her and I let her tell you her story about veganism, about eating disorders, about colon cancer, and the whole story. Sami, welcome to my community.
Thank you very much for inviting me on your community on the show. I'd like to talk about today not only my cancer story, but also, as you, Doctor, mentioned it, about my diet history. Let me start to talk about when I was a kid. When I was 6 years old, I became vegan was because of the fact that at that time, I had a lot of skin issues like hives or allergic reaction or eczema. Then one day, my mom, she took me to a dermatologist where that dermatologist told me the reason I had skin issue was because of I was eating animal flesh. Since then, I became a vegan. Of course, I was really malnourished and I was really messed up child. And to the point, when I was 15 years old, I developed severe eating disorder. I couldn't stop eating whole day, every day. As a compensation, I consumed or I took 250 laxatives a day, laxative tablets a day. That's of the severity. And at that time, I went to a psychiatrist, despite the fact that the psychiatrist had published several books. They are all about mental illness and stuff, but he didn't know anything about bulimia, which I had. So he just gave me 17 tablets of psychiatric medicine a day. Anyway, I survived.
How old was you? How old were you when you got this psychiatric?
15 or 16 years old at the time. 1 year later, onset of bulimia. When I went to the psychiatrist, knew nothing about bulimia.
Yes.
But despite of the severity, my mental disorder or eating disorder to be exact, when I was 39, it was 2011, I discovered ketogenic diet. Then I gave it a try, nothing to lose. I increased fat intake. Previously, I was terrified about eating fat. I squeezed French fry to eat. That's kind of a fear. I couldn't eat fat, but I increased the fat. I think that's helped. Like a recover from eating disorder.
But excuse me, Sami, which kind of eating disorders did you have?
I would say bulimic. I just couldn't stop eating whole day, stuffing. Actually, I wasn't eating bad food, so-called bad food. I was eating fruits and vegetables and whole grain whole day.
Yes.
Stuffed 4 or 5 buckets of vegetables and then taking a laxative this is a time I must have developed colon cancer, prolonged irritation in my colon
I see.
caused cancer. I completely no doubt about that. But the keto helped my psychiatric disease. But keto didn't help my GI issue, gastric intestinal issue, especially bloating. My guts was so distended after eating. And then
But
at that time,
excuse me,
yes.
Sami, can I ask you, which kind of keto diet did you have you eaten? then?
Yes, yes,
What,
yes.
what was what you ate mostly at the time?
Yes, good question, doctor. Still, my brain was hijacked by veganism, vegetable is always good. That's why I call it plant-based keto. Nuts and seeds and avocados and, kind of a little bit chicken stuff, but mostly fruits. Oh, no. Like a vegetable. Yes, thank you. Vegetable based. But the thing is that it was 2018. I discovered the diet, which is zero carb diet. Zero carb. Zero carb means you are going to eat carnivore diet, isn't it, doctor? So I dove into that carnivore diet, 2018.
18, okay.
18. That was a game changer. Why? Because my, bloating went away completely. My stomach flattened completely. And then also my energy went through the roof. I'm so into fitness. I started to do weightlifting even. I thought I was one of the most strongest, healthiest people on this planet until 2020, where there are many publications about microbiome. Feed the gut with fiber. I thought maybe it was last piece of puzzle I was missing, I thought. And then I reincorporated the vegetable into my diet, even though I knew carnivore helped to my digestion, but I gave it a try. And then, doctor, my bloating made a great comeback. I became, again, bloated person. But I kept going because, as they say, your gut is going to get used to the new environment, fiber. So I kept going until 2021, April, after eating lettuce or mushroom. I had a stomach ache, kind of a dull pain, and it was intensifying. Next day, I went to the big hospital where they found the fact that I was incubating very, very advanced stage of colon cancer, stage 4, terminal, already metastasized to my liver and some lymph nodes. Then I had an operations, and following that, I had a chemotherapy. After 4 months later of my operation, already they found new metastases in my liver again. Now, doctor, I gained the understanding of how less effective conventional approach for cancer treatment can be. But at that time, I sent an email to Dr. Safely. Doctor, shall I explain that who is Dr. Safely now?
Yeah, please explain, because my community, I mean, most of my community maybe doesn't know who he is.
Okay. Then I'm going to introduce a great man called Dr. Safely. He's a cancer biologist, one of the most biggest voices in metabolic approach for cancer treatment. Metabolic approach is, in a nutshell, a cancer cell gets fueled by 2 energy substrates. One is glucose, 2 is glutamine. And in his approach or metabolic approach, you are going to be on the ketogenic diet. Idea behind it is that ketogenic diet is a very, very low carbohydrate diet. Means you are going to have a low glucose level in your system. And then also yes, go on.
Excuse me, Sami.
Yes.
We have also to explain that ketogenic diet is not only a very low carbohydrate diet, because you have mostly less than 20 grams carbs, but it's high fat because it's 70% fat.
Yes.
That's
Yes, thank you very much, Doctor. Yes. Not only the low fat, low carbohydrate, but also you are going to increase the fat contents. And the thing is that interesting though is that people, our body is capable to use glucose and ketones. Even your brain is able to use glucose and ketones, but cancer cells are not able to use ketones. That's why if you cut the glucose from your system and taking a glutamine blocker, your cancer is able to survive. So this is the idea of metabolic approach for cancer treatment. So,
excuse me, Sami, can you tell my community how do you measure your ketones? In which way?
Yeah, there are two ways. You can check the ketone levels. One is a urine test. The other one is a blood test. And I do blood tests using the device called Keto Mojo. In my opinion, blood test to check ketone levels, glucose level is more accurate. But still, there are people who are not able to, can't afford to buy Keto Mojo or blood test device. Still, it's worthwhile checking your ketone level using a urine. Better than nothing. At least you will know that, I am producing a keto.
And
that's a good feedback.
Which is the range you have on Keto Mojo from ketones? In which range are you mostly?
Yes, the good question. And to get the therapeutic effect, it should be better if you have a ketone level 0.5 to 2.5. That the ketone, it's going to be categorized as almost medicine. It has an anti-inflammatory effect and lowering your hunger signal, good for fat loss.
Okay, no, that's very important for my community.
Yes,
to know.
Yeah,
and so
yes. Sorry, I was going to say, Dr. Safely establish how to measure or how to calculate where at using a GKI number. GKI number stands for glucose keto index. This is his the establishment. So as a cancer treatment, you are supposed to have a lower GKI number. Ideally, lower than 2. If you have a lower than 1, you are absolutely kill. You are able to not kill. I shouldn't say kill. You are able to manage the cancer. Yeah.
That's very important. A very important message.
Right.
We can also tell my community that Professor Seyfried, he's in Boston.
Yes.
Surely one of the best voices, of the most important voices worldwide about metabolic cancer approach.
Yes.
He has written books, and he's not in Harvard, but he's close to Harvard. But
yes, more than Harvard.
No, it's very interesting because I met about a couple of years ago
I see.
Not him, but one of his very important colleagues who is studying glioblastoma multiforme.
Oh, yes.
she told me that also people in Harvard who are working there, when they have problems with cancer, they go to Professor Seyfried. And
Yes.
the approach also to glioblastoma, it's an inoperable brain tumor with ketogenic diet is known to be very, very helpful. I can testimony. I verified it about a patient of mine. She's on paleo keto since many years now. She had a glioblastoma. She has been operated, and she had a recidiva of glioblastoma, and now with the paleo keto diet, she lives, and the tumor has been there.
Aha, I see. Great.
Unchanged. And also,
okay.
and also the big and wonderful story from Andrew. He has a name, carnivore. I don't know. I met him in Sheffield in May. I mean, he's about 25, 26, with 14 years. He has been diagnosed with glioblastoma, and he inoperable. And he started a keto, and now he's since 8 years on carnivore, very, very strictly, without vegetables. And since he's in carnivore, he hasn't epileptic
seizure. Yeah, epileptic
seizures. Okay, anymore. It's
Mouthful.
really very, very interesting, and he survived it, and he knows he has to be very, very careful.
Yes, I understand that.
In UK, it's more difficult because you have everywhere in the foods sugar.
Yes, everywhere.
And
So,
in Japan too.
Exactly. If you buy any packaged food, hidden sugar is it. These days, food industry became so clever to the point that I have heard that there are 20 or 30 different names just describe sugar. You see? Even here's the thing. If you even choose the savory food, go well with rice and pasta, there is a sugar in it.
No, of course.
It's crazy.
Yeah, of course. But in England, they have sugar also when you go to a restaurant and you order meat. You get sugar also. Yeah, it's terrible.
It's
because
crazy.
we had big problems. Sami, and but you told us, okay, we got a diagnosis of lung metastasis, of liver metastasis, and lung metastasis. And when you did the last imaging, I mean radiologic imaging, to control the size of your metastasis?
Oh, that was actually 1 year ago. I had a CT scanning where they found a new metastasis, my lung, because of the fact that previously I was so healthy being on carnivore to the point that I forgot I was cancer patient, and to the point that I increased protein intake. I'm a very tiny person. Even I would eat 200 protein a day.
200,
very small.
200 grams.
Protein, not the gram of protein, just protein.
Yeah, but
day.
It means, with a moment, I tell my community, because maybe there is someone who doesn't know, 200 proteins doesn't mean 200 grams of meat or...
Oh, no.
Yeah, because...
No, definitely not.
Yeah, because 100 grams of meat have about 20 grams of proteins.
Yes,
so
give or take.
Yeah, and so if Sami eats 200 grams of protein, it means it's a lot more of meat, because you are eating now a lion diet, don't you?
I was, and I do right now. But there was a time my goal kind of becoming a different direction. My goal should have been cancer management, but I forgot about I was cancer patient, and then my goal was gym performance. I'm small, that's why I wanted to be big. I wanted to be strong. Hey, look, I'm jacked. I wanted to do that. That's why I increased the protein intake. Not only I was eating the meat, but also I was chunking down a lot of protein shake. And also I started to eat different types of meat. So it's going to be a little bit. Yes.
Can you explain what you mean about different types of meat?
Yes. Previously, I was strict carnivore where I just ate beef, salt, and water. But because of the fact that, let's face it, if you want to increase the protein intake, just eat beef is kind of expensive. That's why I incorporated pork, chicken, eggs, fish, which is namely called monogastric animals. I might have an immunological response to monogastric animals. Let me explain. This is interesting point. The ruminant animals, like a beef or lamb or bison, they have 4 stomach chambers. They are going to digest food slowly using 4 stomach chambers and a particular bacteria, to the point that they are detoxify the food, the food they are eating, even though conventional way to raise cows are not so good. They were given corn, soy, wheat, you name it. But for that stomach reason, GI tract, they were able to detoxify to the point that their flesh is pretty much detoxified. The less inflammatory, let's call it. In contrast, monogastric animal, they have only one stomach. That's why what they eat, it's gonna reflect impact on their flesh. Unfortunately, conventional way to raise chicken, pork, can be fish, is a little bit disappointing. We tend to give them the corn, the soy, the wheat. But a majority of people, you can get away with that. In my case, I have a compromised immunological, like a condition because of the cancer, because of my damaged colon. That's why I do react to certain, monogastric animal flesh. That's why I gone back.
It's really a very interesting theory, this one.
Mm-hmm. Yes, it's theory.
I've never been heard of, but it makes sense. Sami, I don't know, we've forgotten to tell my community that when you went out from veganism, you had a leaky gut with very, very big colon issues, and that you took a lot of laxative.
Yes, indeed. I took a lot of laxative as a compensation of binge eating. They call it purging. And the thing is that our body is very, very capable to deal with big chunk of short time of stress, acute stress. But in terms of the prolonged, low, nagging kind of irritation, this is a thing more detrimental to your system. Yeah. In my case, 24 years of the laxative abuse, on top of that, eating 4 or 5 buckets of fruits and vegetables, whole grain. It's already enough to give me some irritation every day.
Okay. And now, how do you feel?
how do I feel? The thing is that I learned so many mistakes I made in the sense that I allowed myself to give several metastases, and also I achieved many improvements. Doctor, just 1 year ago, I had a last image CT scanning where they found a new metastasis in my lung. They told me that if I wait to have an operation 1 month, it's gonna be too late. I'm gonna die. I haven't be dead yet. So I think that what I'm doing is right. I'm doing something right.
Because of course you listen to yourself, but they told to you that your cancer, I mean, they have never hide it to you that your cancer has a very bad prognosis, didn't they?
Oh yeah, they told me that
They were
many times.
Okay, very open, but you don't have any bad symptoms because of your metastasis now?
It's interesting question. Currently I'm possessing liver metastasis, liver cancer, and lung cancer. I have no symptom. I'm asymptomatic. That's why I go to the gym every day. I do strenuous exercise. I lift a weight. I run. I sprint. Yeah, my lung capability is quite enormously good. I'm quite healthy and strong. I can't believe that. I'm a terminal cancer. Doctor, interesting thing though is that I'm supposed to be hospice. My doctor mentioned that I'm a hospice patient because they gave up.
Okay, but you feel great. And how many times in a day do you eat and when?
Okay, that's a great question. I eat twice a day. First meal starts from 6:30 or 7 o'clock a.m. Last meal is 11 o'clock a.m. That is that. Yeah.
You're making a sort of OMAD.
Not OMAD.
No, a sort of, you have a 20 to 4. You mean you eat at 8 o'clock, the second time at 11 o'clock, and then through the day you don't eat anything.
Yeah, because after eating a lot of fatty beef, you don't feel hungry for hours and hours. But yeah, doctor, I didn't, realize that it can be categorized as OMAD. I always think that, I eat twice a day, 7 and 11. Maybe, categorized as 4 hours window in this content.
Okay. And how much do you drink in a day?
Oh, I don't check. Now you mentioned it. I'm gonna.
But you drink.
Yeah. The liquid, not alcohol, right? Not alcohol. My
no.
Water consumption.
And do you
liquid.
drink? Yeah. Do you drink water, tea, coffee?
Yes. I'm a crazy green tea drinker. Without drinking, I can't function. Not because of the caffeine intake. I can go decaf. Whatever the green tea goes, I'm pretty much happy with that. So I do drink 2 or 3 cups of green tea. And then maybe here and there, I drink just the pure water. But most likely, I drink green tea.
Green tea.
I don't know which is good for cancer treatment, or just that I love green tea, doctor.
And is there a special type of green tea you eat?
Not that so special about it. I go a lot of cheap price range, but I'm happy. When I see the green, already I'm happy.
Okay. And how many time in a week do you make your training?
Every day. But to be fair, you can't lift the heavy lifting consecutive 2 days. I'm gonna sandwich active resting day where I just walk on the treadmill, inclined treadmill. Or this morning, as an active resting day, I carried heavy plate and walk around the gym. Anyway, I go to the gym every day.
And what about light exposure, natural light exposure?
Oh my goodness, I like this conversation. In the morning, early morning, I try to look at the sunlight to reset my circadian biology. Even though it can be, crowded, I look at the sun. It's not that, everybody don't do that. Don't look at the bright sunlight, but I do because I'm an idiot. I really want to sunlight. And then after sunset, I am going to wear blue cut glasses. Like doctor, sometimes you wear glasses like this. I try to mimic the ancestral way to incorporate the natural light into my life.
That's very important. You see, I posted today in Telegram from my folk. There is one study. They studied, it's an observational study about, I think, more than 400,000 women. And that they got about 11 pounds of weight because they had also light exposure, blue light exposure at night, like TV or cellular phone. And because I find it's very important that my folk, that my community understands how it's important your circadian rhythm. And
yes,
most of the people haven't yet.
Interesting. Yeah. Doctor, today I am lighting up this place, but at night, I don't turn the light on at night. This is a special occasion for me to light on.
Which hour is it now in Japan?
It's 4:33, somewhere around PM.
I see. Okay, I see.
Right.
Okay, and then you have light exposure. You protect yourself from blue light at night.
Yes, I do.
Good. And when do you go to sleep?
That is something I've been working on. I try to go to bed 7:30 to 8 o'clock p.m. And but the thing is that I'm not very good at getting sleep right. What I mean by is that sometimes I have a hard time to fall asleep. And that's why I have taken a lot of supplements for it. It's not something I should be proud of. But I'm trying to go to bed 7:30 to 8 o'clock so that I'm able to wake up 2:30 to 3 o'clock a.m. This is my too early, right?
For us, it would be impossible. It would be really, really impossible. Maybe, excuse me, I say this for the new people who are arriving now to this life. You have the possibility to have a translation if you go to Intrapretariato, if you are on your PC, on your computer, okay, on the down, on the bottom, okay, of your computer, or if you are with your cellular phone, you have 3 points. You have to go there. You have to click on Italian and confirm the option, and so you have the simultaneous translation from Enrica and Carmelo. Okay, and I'm very glad, really very glad, Sami, that you told us your story. I'm really glad, and I think you can be proud of you, of your well-being. And
Thank you.
Really that you have many decades of
yes, I have to. I have to be the living proof. Yes, I will be. I have to.
Yeah.
I can't allow to die.
No.
With this community. No.
It's very important also I'm very convinced of it, Sami, that not only the lifestyle that we mentioned now, your lifestyle, and also circadian rhythmic, and also when you eat, that's very important.
Yes.
But also the mental, how you think, it's important.
Yes, yes, doctor. Your brain decides your physiology. Right. I completely agree upon that. I don't want to talk about science like hey, it's if you feel like I don't know how to describe it. I really love science, but science is not very good at dissecting our feeling, emotion, but it's very, very important, the part of any disease treatment.
Of course. Okay. If now some of my community has some questions, I'm sure that Sami is ready to answer them. If you have,
bring it on.
Yeah, if you have to ask something, you are here. You have the possibility to do it on your chat on the bottom of your computer or in domande e risposte. Okay. And or you are gotten already all the questions. If you don't have any so questions about it, and I'll tell you that this live will appear also on my YouTube channel. There is a questions from Ivana. Buongiorno, i medici che seguono la signora sono d'accordo col suo approccio alimentare? And the doctors who are following you, do they agree with your nutritional way of life?
Simple answer is no. They don't. The thing is that there is a big gap between nutrition or science and the practice in medicine. What I mean by is that I was kept in the cancer ward where we were given the full of carbohydrate, big rice and bread, jam, margarine, and canned fruits and cookies and cracker. This is something we were given when I was hospitalized. My point here is that for some reason, the doctors think that still carbohydrate-centered diet is nutritious diet. So let alone cancer treatment. I did describe that I've been on the ketogenic diet. I didn't say carnivore. Nobody understands. I told them that I've been on the ketogenic diet, reducing carbohydrate. They didn't listen. They didn't listen at all. No, nobody understands.
Paula is asking, what about your social life with this kind of living?
Yes. The thing is, I'm a Japanese. Yeah, I don't have a lot of Japanese friends. Most likely, I hang around with my international friends. They understand why I'm eating just meat. That's why I have no problem of socialization by being on carnivore diet at all. Pretty much I'm okay.
And then Stefania is asking, how did you block glutamine?
Oh, that's a good question. I
have very, very, very cute followers.
Okay, I'm going to give a speech about it. There are certain medicine which blocks uptake, absorption of glutamine. The thing is that the fact that the glutamine blockers are very, very cheap in the form of dog dewormers, anti-parasite drug for cats and dogs. I'm taking fenbenzodol, which is an anti-parasite drug for cats and dogs. So this is the way you are going to take antiparasitic drug. No. You are taking the glutamine blockers in the form of dog's anti-parasite drug. Here's a important message. Glutamine is very, very important nutrient for your body, especially your mucus, your gut lining, and also in your immune system and your muscle recovery. We all need glutamine. But at the same time, cancer can utilize glutamine to increase, to make energy. Here's a way we're going to take. 3 days, I take glutamine blockers, where I am kind of starving my cancer. And in 4 days, I don't take glutamine blockers, where I'm going to give myself glutamine as a nutrient. I'm going to circle this. There is a theory. If your cancer is aggressive, you should take glutamine blockers 4 or 5 days a week, and the rest 1 or 2 days. And if your cancer is almost like a remission, maybe once in a day you take glutamine blockers. 6 days you are going to rest to take glutamine blockers. It depends on the condition. It's not that some randomized clinical study has been done yet.
Sami, what do you mean with glutamine blockers?
Glutamine blockers is the stop you from
blockers. You mean blockers?
Glutamine blockers.
You mean blockers or brokers?
Brokers or brokers. The plural, singular or plural?
No. Se mi aiuta Carmelo e Enrica, se loro hanno capito che cosa intende Sami col glutamine blockers, perché io qui non l'ho capito. You've seen now if Carmelo or okay, no. Glutamine blockers. Okay.
Blockers. Yeah,
okay,
blockers. Block the glutamine.
Then it's right. I understood. Okay. And which are the glutamine blockers?
I've been taking fenbendazole. This is the name of the active ingredient.
I see.
Of the glutamine blockers I'm taking.
Okay. And now we go to the other questions. Alessia is asking, Manuela, how old are you?
How old am I? I am 50 years old. I'm living on this planet half of the century, doctor.
Okay. And Alessia is asking, no, Alessia, it's a ketogenic diet. Okay, no, we are... Anna is asking if you had chemotherapy and radiotherapy for metastasis.
Could you say it again?
If you have chemotherapy and radiotherapy for your metastasis?
No. After operation, I did the chemotherapy session, just 3 months. But months 4, already they found that new metastasis. They gave up on me. So they stopped doing chemotherapy session with me. I didn't do any radiotherapy.
Okay, only chemotherapy, but when you have been operated?
Operation was 2021.
Yeah, and then you had after the operation chemotherapy.
After operation chemotherapy.
Okay, and then I think because there are also questions about the contents of glutamine in meat, of course, but you have heard that she took blockers, glutamine blockers, and then Paula is very interested to know
Mhm.
how did you overcome the binge eating?
Oh, that's good question. This is something I'm more knowledgeable than cancer biology because I was suffering eating disorder 24 years. Here's a simple answer. When I was having an eating disorder life, I was terrified about eating fat. Zero fat, zero fat. This is my mantra. Then I went on ketogenic diet, where you know that ketogenic diet is a high fat, low carb. High fat, high fat is just something corrected my brain. Finally, my brain realized, oh, I'm getting a nutrient. I don't need to crave food anymore. I needed to have a fat. Fat is, I think, a healing process for me, at least. I'm kind of vocal about eating disorder. There are many studies. They say, oh, this is a psychology, your child trauma. Yes, I did traumatic event in my childhood. I was abandoned, all of the neglected, or whatever it is. But biggest thing for me is a nutrition deficiency. That's caused eating disorder. Let's think about it. I was vegan. I didn't have enough fat, especially fat, omega-3s, omega-6s, especially coming from animal fat. The carbon 20 to 22, DPA, EHA. This is the true fat my brain was craving for.
Yeah,
So,
of course.
Yeah, fat content matters.
And then you told me that when you went on keto at the beginning,
Mhm.
you went on keto, but mostly with vegetables.
Yes.
And
yes.
you were very bloated. You were
Right. Yes,
no.
despite the fact that I dove into the keto, still I was thinking that, oh, fruits and vegetables is always good. It's a social engineered mantra, doctor, isn't it? That's why still I was terrified about eating a lot of meat. That's why I was kind of a type of pescatarian type of diet. Keto, pescatarian, plant-based.
It's important, but you were better than before.
Oh,
yes. But not still good. Valentina is telling you compliments for your courage, and it's really wonderful to hear someone who listened to his body to 100%, and she thank you very much for your story.
Oh my goodness, I'm touched. Thank you very much for saying that. That's the moment I'm really, really happy.
Lara is asking, your eating disorder, have it begun when you were vegan? That's the first question. And the second, maybe your eating disorder and your veganism, you think it was the main cause of your cancer?
Actually, there are some papers suggesting that vegan, children, they are highly chanced to develop eating disorder. I know why, because doctor, still malnutrition. If you are vegan, you are absolutely lacking zinc, heme iron, and a vitamin B12, and a vitamin K3, D3, all of which should come from animal. And also, they were the one that correlate brain neurodevelopment. No wonder, vegan people tend to pick up eating disorder over omnivorous.
And your intestinal functions are now normal?
It's a great question. I must say, I sometimes have a hard time to get my regular, to be regular. And quite recently, doctor, despite the fact that I'm advocating carnivore. I have incorporated small portion of kimchi, Korean pickles.
Kimchi. Wonderful. I see.
Yeah.
Fermented.
Yes.
Kimchi. I see.
Yeah. In the
Yes.
hope that I think that it shows some improvement a bit in terms of my regularity of my bowel. Small portion.
I see. Okay. Barbara has some problems to understand the connection, what you told us about glutamine. Can you repeat what you do?
Sure. Okay, here's the thing. Cancer gets fueled by two energy substrates, two sources of energy. One is glucose. This is the main cancer's food. The other one is glutamine. Glutamine is one of the amino acids. Whatever you do, you eat, from vegetable, meat, nuts, fish, it's always glutamine in it. That's why it's impossible to get rid of the glutamine from your diet. That's why we need to take glutamine blockers to avoid you from absorbing glutamine excessively.
Too much glutamine.
Too much.
But
so yes,
Sami, because there is another question. It's connected to this one. But if you eat keto, you don't have this danger.
You don't have to.
You don't have this danger with glutamine because keto, it's not a hyperproteic diet as carnivore is. It's a hyperlipidic diet.
So a hyperlipid, yes. Carnivore doesn't necessarily you are going to have ketones a lot. Sometimes there are some portion of people in carnivore community, they were advocating the high carb, high protein keto, which is fine if you don't have any psychiatric disease or cancer or diabetes. I don't mind if it works. But for us, cancer patient, you have to have a deep level of the ketones. So to do this, you can't achieve this with high protein carnivore diet. That's what I learned.
But then, the solution would be to be on keto only without glutamine blockers, but to eat keto with 70% with 70% lipids.
Fat. The thing is that actually it's individual comes into play. For some people, even 60% of the fat or lipid contents, still they can achieve the very deep level of the ketones. Or some people, despite of the 70%, 80%, they can't achieve until their fat goes up to 90%. It's very, very individual.
I see. No, it's very individual. You have seen, for example, that with monogastric animals, you have problems to stay on keto.
Yes, in my case, I didn't check which monogastric animals affected my, a ketone level. I can't afford to try to find. Just that I'm cut off everything.
Yes. No. But thank you very much. No, it's important, and then everyone has to measure. Also, if you are
have to measure.
Because you have a metabolic issue, or if you have, I don't know, an inflammatory issue. Ketogenic diet is of short a solution, but you have to check your ketogenic state because everyone. I've seen.
Sorry. One thing, I'm sorry, I was going to say this. Having said all of that, if you are healthy, I don't think you should I don't think you should just pursue the high ketone all the time. You don't need that. I think that only people like myself, we have to always chasing high ketone, or if you have a seizure or problem, epileptic, you always find a high ketone food. But other than that, if you are normal people, just your goal is fat loss. Just sometimes you have to be ketones, but you don't need to have a deep ketones all the time.
Yeah, of course.
Sorry, continue you.
No, it's your story is really very, very important. I have to put on it that at the University of Würzburg in Germany, they are putting all the women with breast cancer on ketogenic diet.
Oh.
It doesn't happen in Italy. In Italy, I'm only very sorry, they take them away the red meat, because there is I have many patients who got information and advice with endometriosis, with breast cancer, with colon cancer, to cancel red meat. And mostly for inflammatory disease, it's really it's terrible, because the people go down to too much carbohydrates. Okay, it's so
right.
Okay, good. Sami, thank you very much. Really, thank you very much.
Thank you very much.
Your,
really, I enjoyed that. Thank you very much,
story.
everyone.
Thank you.
You're
Thank
welcome.
you to my community, and thank you always to Enrica and to Carmelo for translating it.
Thank you for translation.
Really, thank you for your story, and I wish you good luck and a lot of health.
Thank you. Same to you, doctor.
Thank you. Bye, Sami. Bye to all of you.
Bye bye.
Nice day.
Bye bye.
Bye.
Ciao, everybody. Bye bye.